India's Health Minister Dr. Mansukh Mandavia reviewed the COVID-19 situation and preparedness of public health system for surveillance, containment and management in view of rising COVID-19 cases in some parts of the country. Minister Mandavia said health is not an area for politics and that there should be no laxity in preparedness by state or national governments. It's important to be on alert and we prepare against new and emerging strains of COVID-19 virus. He called for mock drills once every 3 months at both the national and state levels. The meeting comes after a new COVID-19 subvariant called JN1 was detected in India's southern state of Kerala. Now, Health Minister Mandavia at the review meeting emphasized that his ministry is available for every support that states will require. He proposed a whole-of-government approach to tackle any upsurge in cases. He said there was nothing to panic about the new variant, that's the JN1 variant, and he assured that the virus was under close watch. Dr. V.K. Paul, a member of Niti Aayog, said in a statement after the meeting that there was no need for panic. He said most patients were showing minor symptoms and that 90% of the patients were recovering at home. He said an upsurge in COVID-19 cases is under a close watch.
It is not serious by itself. WHO has named it as a variant of interest. That means we watch it carefully. We keep on tracking this, keep on understanding its structure and so on. This variant has been present in 36 to 40 other countries, originally reported in Europe way back in August. So it's under watch. We are tracking the virus carefully. The JN.1 confirmed in Kerala in one case and 21 other cases and Goa are being tracked. So this virus subvariant is there in our country. And this is the same virus, as I said, which is driving upsurge in other countries. But we don't have to worry.
And joining me is my colleague Akshay Dongri for more on this developing story. Akshay, what was the central message of the minister to the participants in that meeting? What more can you tell us about his proposal of a whole-of-government approach to tackle this situation?
Well, Ramesh, first of all, it is a welcome step that the Union Health Ministry of India has in fact held a meeting with almost all the state health ministers and the officials, the top health officials of the country to discuss this particular variant of interest that has been recognized by a variant of interest by the World Health Organization, the JN1 variant that has been spreading in several countries. It has been present in about 30 to 35 countries as of now, and it has also now been detected in India. So the message has been very clear that there should be no politics over health. It is one subject that should concern each and every state, every government, every political party, and that is why everyone should be united as far as tackling COVID is concerned. We have seen the kind of impact COVID can have, especially during the Delta variant wave in 2022, where India along with the entire world face unprecedented challenges emerging out of COVID, be it the lack of ventilators, lack of oxygen. So all of those issues have been ramped up as far as the preparedness is concerned. So the central message that is coming from the Union Health Ministry is only one, that everyone should be prepared. There should be genome sequencing of all the patients that are being found with COVID positive. The kind of variant that they are infected with, that should be determined, and the kind of severity that also should be reported. So there should be comprehensive checks, there should be preparedness, there should be mock drills. The state should be prepared with enough oxygen supplies, beds, hospitals. So there should be no careless behavior by any state government or health authorities, which can in fact give sort of liberty to COVID to spread, especially during the festive season. There is Christmas, there is New York, there are parties all over. So during those times, especially, people should monitor their health. So the message is both to the state government as well as to the people that you should be on alert. And while the severity of the cases because of the JN1 variant has been low, it doesn't mean that there cannot be be any sub-variants. That has been told by the expert from the very beginning after the outbreak of COVID, that COVID can have sub-variants, and the severity and the kind of infectiousness of the variant can vary from variant to variant. So that is why even while we are in an endemic, one thing is very clear, that we cannot be careless about the spread of COVID-19, and the state governments, the Union Health Ministry, as well as the local health authorities should be work in cohesion to ensure that COVID doesn't spread and no lives are lost because of this new variant that is now being detected in India as well.
So as Akshay was reporting there is no need for panic. The situation is under close watch, and that the governments at the national and state levels are doing all they can to control and monitor the situation. Akshay, thank you for now.